All right, today we're going to talk about my low back pain. Now, this is not medical advice or replacement for sound medical advice. This is just what I did in my particular situation, and hopefully there's some nuggets in here that you all can take away if you are experiencing low back pain, which if you're a bodybuilder, some low back issues may have plagued you in the past. Here are the things I did, the order I did them, and the order I wish I did them. Let's get to the episode. First of all, my best guess. My low back issues were somewhere around, I'd say L3, L4. Now, I never got medical imaging, and we'll get to that in a little bit, but that is my best guess as far as the way it felt to me. Now, things to note about my particular low back issues. I imagine this happened, I don't know, probably around 10 years ago. You know, I'm slightly into my bodybuilding career. I'm deadlifting heavy, I'm deadlifting multiple times a week, and I do not have a strong enough respect for volume and fatigue. And, you know, probably my best guess form was questionable. I don't have very explicit memories about that time, but safe to say, with the amount of back issues that I dealt with, it had to be some combination of fatigue, volume, and poor form. We live and we learn. Now, here are some things to note sort of functionally about what happened to me. So whenever my back was, I'll just say, acting up, again, this is not from a professional perspective. This is just my take on my low back injury. So whenever it occurs, it hasn't in a long while, which is why I'm making this video. So hopefully some of this will help you all. If I was having sort of a flare-up, I couldn't wear a backpack. It was hard to sort of push mow my lawn because I would experience some very sharp sort of electrical storm-like pain right there in the L3 to L4 region. The cool thing about my back pain is that it didn't radiate down my leg. I think for a lot of people, sometimes this pain may radiate down their leg. So cool thing is mine was fairly isolated. I couldn't really tell if it was off to one side or another. It felt very centralized in wherever that disc was, or disc is, hopefully. Again, sort of the way I came at this was figuring out where does it hurt the most. Wearing a backpack at first, sort of any type of axial loading, that really hurts. So I mean, if you can imagine like a backpack hurting, that means, I certainly wasn't carrying very many heavy things. Something else that sort of caused it to flare up, any sort of bending forward motion. But if I was able to keep a good arch in my low back, it tended to hurt less. However, immediately after I had some type of a flare-up, there was no sort of bending forward either. So axial loading, bending forward. And then another thing that I noticed is that it felt better when I laid on my stomach and did a prone press up. So pressing up while I was laying on the floor actively made my back feel better, and it actually almost felt like that little disc was shooting back in there. I couldn't feel that exactly, but those things made it feel better, and that was just through sort of self-discovery and sort of self-research online, something I did for myself, not what I'm recommending you all do, but that's sort of how I came to think about this as a disc issue. Now, I couldn't tell you whether this was bulging or herniated. It wasn't muscular in nature. Heating pads didn't really make a difference, and it was very much a shooting, sharp pain whenever I made inappropriate movements, whenever it was flared up. Last thing I want to say before we get into what I did is I want to impart a little bit of hope. So I have been dealing with back issues for the better part of the last decade. However, over the last year and a half, after implementing some of these strategies, I have not had any flare-ups at all with my back. And so I'm sort of on a maintenance level of volumes with some of the things that I do. So hopefully, if you all can sort of take some of this, apply it to what you're doing, and seek professional help more than anything, then hopefully you can make progress in your journey, even with some low back stuff, which I know can be debilitating and really shitty. So I feel you, I do. So the number one thing that I did was time off of certain exercises. The two main exercises, or the two main types of exercises that I took time off of were sort of axially loading exercises and then any sort of hip hinging exercises. Now, initially, that was a month maybe or more off of anything like that, and then gradually reintroducing some of those exercises. But in that time, I had to learn how to train my legs differently and with a lot of machine work, but I took time off of the exercises that were exacerbating the pain. The second thing that I did was gradually reintroduce the exercises that sort of used to cause the pain to flare up. Now, the way I sort of reintroduced axial loading was, well, I didn't really load anything at all at first. I just did body weight squats, and then I I did single leg body weight stuff, 4 reps, and then I moved into rear foot elevated split squats with weight. So I started weighting the single leg stuff, and then I started weighting both my legs with the leg press, although I had to modify the leg press a little bit just so that I could keep a really good arch in my back, which I still do to this day. I roll up either a towel or I find a foam roller or something that I can stick back behind the leg press pad, because a lot of these machines aren't great in terms of helping you keep an arch in your low back. So I had to modify there. So I think I loaded that. I went single leg on that first, and then I went to bilateral and started loading up the leg press. And then eventually I went over to Smith machine squats, and I didn't have to worry as much about the form in a Smith machine because you were in a fixed position. If you get your feet down right, I could really focusing on creating that rigid spine and keeping a good arch in my low back whenever I progress that movement. The third thing I did, which was really great, and honestly, to the point where I actually bought the piece of equipment, was find alternative high SFR movements. So like I was saying earlier with a leg press, that's a fairly high SFR movement for me, and it's an alternative to squatting. Now we all now know in bodybuilding that there are no movements that are mandatory. There are some movements that are better and worse on SFR, and sort of that F component, the fatigue component, is different for everybody based on any number of things, anthropometry, distribution of muscle fibers, and then also injury status and age. Like it's just a thing that comes with it. So your fatigue is going to be higher for movements that tax you and aggravate injuries. So for me, regular just barbell back squatting was too aggravating to a particular injury, so the fatigue cost was just too much, so I had to find alternatives. The thing that I found was the belt squat. This thing is amazing. So amazing, in fact, I bought it and put it downstairs in my basement where I train most of the time. Now with the belt squat, it loads your hip and you don't have to put any weight on your spine. It is incredible. And if you have some extra bumper plates laying around and you put that on the platform, you can get even deeper into your belt squat than I could a regular squat, and there's no loading of your spine. So that is a really great piece of equipment that I sort of substituted, and honestly, it's permanently in the rotation in terms of what I do to help grow my legs. And it's the fatigue cost in it is extraordinarily low, almost zero in terms of what it does to my spine. As I was saying, my low back has sort of pestered me for like the last 10 years. So there are other things that I have done in terms of rehabilitative exercises outside of seeing a professional. Now, again, see a professional, and I'll get to whenever I had done that. But for me, I looked and read online, and I came across a doctor named Dr. Stu McGill. Now, Stu McGill is he's known as the back mechanic in a bunch of professional circles, in strongman circles, and in many other sport-specific circles. And he is known for helping people with low back issues. And I'll put a recommendation for one of his books up here and in the descriptions. So he has this big three. It is the bird dog, the McGill curl up, obviously probably named after him, and then the side plank. These are the 3 exercises that sort of whenever I began wanting to strengthen and train my low back again, that I implemented to help in the recovery process. Now, for most of the big 3, you will be focusing on strengthening your core with keeping a good arch in your low back and having sort of minimal flexion to your abdominals. Sort of shifting back to another piece of equipment that helped me along the way, and I am thankful for having downstairs in my basement, is the Louis Simmons reverse hyper machine. RIP Louis Simmons, but this is one of the things that has helped my back tremendously. It is a reverse hyper that is loadable, and so this helps with, as some people tell me, this helps with decompression. It has allowed me to strengthen my low back, glutes, and hamstrings in a way that doesn't cause me to overly flex my spine, and has greatly improved sort of the strength in my low back and helped with my rehabilitation. Unfortunately, one of the lowest things on this list is physical therapy. I waited a little too long. I waited too long, entirely too long, probably 8 years too long before I went and actually saw a physical therapist. Now, one of the things that sort of kept me was ruminating and problem solving on, do I need to get imaging first? Should I see a PT? Let me see if I can do this or that exercises. Physical therapy is one of the things I wished I would have done First, for a number of reasons. Number one thing, I wish I would have started with a deeper understanding of proper technique, had a respect for volume, frequency, and intensity, and just sort of the modulation of those things. I would have prioritized exercise selections with higher SFR movements, specifically for a bodybuilding purposes. For a number of years, I low bar back squatted with no intention of like powerlifting or anything. I was just doing that because that's just what I did. And so I wish I would have prioritized more of a high bar back squat or even a Smith machine squat for the purposes of growing my legs, because that's what I was trying to do, was grow my legs. So prioritizing the proper movement patterns, and then really just going and seeing a PT. Now, part of the reason I wanted to see a PT, or part of the reason I should have seen a PT, was one, they can perform tests. They can perform tests on your body and be able to isolate where pain is coming from and be able to rule out what a pain is and isn't based on you working with them, which is so... which I feel so dumb for having not really thought all the way through that. But you are going to these people who are not only experts in sort of the rehabilitation side, but in the diagnostic side. I don't know if I downplayed that in my mind, but I just didn't factor it in enough. It's not only that, yes, they were going to help me in the long term with rehabilitation, but the diagnostic aspect. They are able to tell you, or get a closer approximation than you would have or I would have, to what the actual issue is and what you can do about it. In my case, one of the things that was holding me up is like, I didn't know if I needed medical imaging or not. Like, should I go get medical imaging first? How do I get medical imaging first? Do I need an MRI? Am I going to need an X-ray? Am I going to need this? Am I going to need that? As it turns out, based on these symptoms that I was presenting with, maybe not what you're presenting with, but where I was presenting with, the fact that it was localized, the fact that it felt better when I was doing prone press-ups, the fact that it irritated me when I was actually loading, the fact that it irritated me sometimes whenever I was hip hinging and didn't keep an arch in my back, it didn't radiate down my leg or things like that. My physical therapist was able to tell me that regardless of what the medical imaging showed, like it could show a bulging disc, they would have treated me the same way. And in fact, he let me know that a lot of people show up for bulging discs on medical imaging and are asymptomatic. It's just a thing that people have as they age. They just have bulging discs, and sometimes it hurts, sometimes it doesn't, and there's no way to tell until the person comes in and goes, ouch, ouch. Like that's it for some people with bulging disc. And for me, my bulging disc was probably related to any combination of volume and bad form. But if I had just gone in, he would have told me, one, you don't need the imaging based on what I presented with symptom-wise. And two, here are some exercises that you can do that can help modify and help with the pain. So what did he prescribe to me? So first he prescribed quite a few stretches, and that's what we went through. So stretching my quadriceps, my hip flexors, my hamstrings, my calves. Those were things that he provided me with exercises for that sort of helped take the tension off of my low back. And some of those stretches I still do to this day. I do a couch stretch to this day. I stretch out my hamstrings to this day. I stretch out my glutes to this day, something I didn't mention before, but also keeping my glutes nice and loose or nice and stretched out. Those things I keep stretched, and I only stretch them for about 30 seconds each day, and that is enough to help maintain the quality of my movement so that they're not sort of impinging and pulling on my low back. If I had to do it all over again, like I had said, going back to PT, and then I would have moved on to reincorporating older movements, gradually exposing myself to higher and higher stimuluses, incorporating some Stu McGill's Big Three, and then adding on the reverse hyper for strengthening. I wish I had just gone back, seen the PT first, so that I could actually get diagnostic clarification on what was going on with me. My whole issue is, and I'll stick to this, I really think that it was because I was only thinking about a PT in terms of what they were going to do for me on the rehabilitation side, and I just didn't even think about the diagnostic side. And perhaps I'm thinking about this wrong, and I think that's something that we should all do, is are we thinking about this in the most accurate way possible? And if we're not, especially when it comes to injury or something like that, we need to get to a professional. So link for that book by Stu McGill in the description. I'll go ahead and throw in a link for the reverse hyper and a couple of the videos on the Big Three that I find useful here on YouTube. And again, remember, this isn't medical advice. This is just what helped me. I hope it helps you out. And if you're having any low back issues, or honestly, any medical issues related to your lifting, I hope you'll go and see a professional who can help you out with that. Speaking of issues, check out this next video on a mental skill that I think will really help you out in your bodybuilding and lifting journey. I'll see you there.